All right. Good evening, everyone. My name is E.R. Anderson. I'm the executive director of Charis Circle. Charis Circle is a nonprofit programming arm of Charis Books, and Charis Books is the South's oldest independent feminist bookstore. We have been around since 1974. We have been very happy to be here in this building since 2019. And we're very excited to have you all here tonight for a conversation about this important book, which is called Floored, A Complete Guide to Women's Pelvic Floor Health at Every Age and Stage. We're here with the author, Dr. Sara Reardon, in conversation with Dr. Jessica Reale. And we have two co-hosts or co-sponsors of tonight's event, and we're really excited for that. So one is Southern Pelvic Health. And Southern Pelvic Health is the leading pelvic health physical therapy practice in the greater Atlanta area, committed to treating each patient with true care. Our expert physical therapists are specialized in treating everyone with a pelvis through every stage of life. So you'll hear more about Southern Pelvic Health since Dr. Jessica happens to be involved with them. And we wanted to invite our friends from Kemper Pelvic Physio as well, because they've been very thoughtful in the ways that they have reached out to Charis and to our local community, and particularly in the ways that they have also served everyone with a pelvis. So they say they are a specialized physical therapy clinic for everyone who has a pelvis. Their expertise stems from an office-wide passion for helping folks navigate pelvic pain in any capacity. They see people of all ages, genders, and sexual orientations and strive to create a welcoming and effective experience for every individual. If you have a pelvis, KPP is a place for you. So I wanted to begin by thanking both of these great clinics and spaces because just destigmatizing that is really important. And I know for the people who come to Charis who are looking for this information, one of the places to start is just knowing that it's not only for one kind of person. So thank you all for all of the work that you do, and thank you for co-sponsoring the event tonight. Our conversation partner tonight, Dr. Jessica Reale, is a board-certified pelvic health specialist and owner of Southern Pelvic Health, a multi-clinician physical therapy practice in the Atlanta area. She has taught alongside Sara through the Herman and Wallace Pelvic Rehabilitation Institute and is co-owner of Pelvic Floor University, offering online education for pelvic health professionals. She lives in Atlanta with her husband and her two daughters. And the woman of the hour is Dr. Sara Reardon. Since 2007, she has been caring for people's pelvic floors as a doctor of physical therapy and board-certified pelvic floor physical therapist. She is the founder of the V-Hive, an online, on-demand pelvic floor workout platform for pregnancy, postpartum, menopause, painful sex, and pelvic floor strengthening. As the Vagina Whisperer on Instagram and TikTok, she has hundreds of thousands of followers. Sara lives in her hometown, New Orleans, Louisiana, with her husband and two children. And this is her first book. So we're really always excited to get to help celebrate people's first books. So thank you for giving us that honor. And we're really glad for all of you to be here, both online and in person. And so you're going to get the opportunity to hear these two folks have this conversation, and then we're going to let y'all ask questions. So if you're physically in the room, the only thing I ask is you please let me bring you the microphone so that everyone can hear you, because to the people online, it'll just sound like silence if you don't speak into the microphone. And for our online folks, just put your questions in the chat at any time, and we'll read them out loud when the time is right. So please put your hands together for our two wonderful doctors. All right.
Thank you so much, everyone, for being here tonight. It is truly an honor and a privilege to be sitting next to Sara tonight. Sara is a very important person in my life and a dear friend of mine. And honestly, I've told Sara this a million times, but I am, as a pelvic health physical therapist, I'm incredibly deeply grateful for Sara's work and advocacy for our profession. So I'm going to tell you. So I would tell you all, when Sara and I first met, it was when we were teaching alongside each other. We both taught for many years, helping people through their entry-level coursework going into pelvic floor rehabilitation. And the first class we got together, I came to the class and suddenly we're getting started. Sarah and I had just met that morning. I was not on Instagram. I was not anything like that. And suddenly all these people are coming up and asking for pictures. And I hear people being like, that's the Vagina Whisperer. That's this. And I'm like, and then Sarah introduces herself and she's super humble and she's like, I have a small presence on Instagram and blah, 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 and continues talking. And so I get home from teaching and I'm like, what is this situation? And I go online and realize that Sarah has a large platform and has been really reaching, now, I mean, gosh, like hundreds of thousands of people all over the world on pelvic health. And so to kick us off today, as I was shocked, you may be shocked to hear of the Vagina Whisperer. And I would love, Sarah, if you could share a little bit about how you became the Vagina Whisperer.
Thank you, Beth. So before we even launch into me, thank all of you for being here. I do not take it for granted. Evening, and when ER mentions like I'm the woman of the hour, I'm like, no, y'all are the women of the hour. And I do this because I love what I do, and I feel like everyone deserves access to this information. I really hope that we have more events celebrating talking about pelvic floor health, and it's just really wild to me that 5 years ago I don't think we would be in a room sitting like this talking about pelvic floor health so openly and candidly, and we've just come such a long way and we have so much further to go. So thank you for being here. It's true. So I know that Kimber and all pelvises, I treat vaginas, like that's it. But I started as a pelvic floor physical therapist in 2007. This was my first job out of physical therapy school. And during PT school, I did a clinical rotation in what was then called women's health, is now called pelvic health. And what I loved was not just understanding my own body, but helping other women understand their bodies and helping them walk through something that was really intimate, often embarrassing, really challenging, but affecting their quality of life in such a huge way. From whether it was, having difficulty becoming sexually active, having constipation that was preventing, travel, recovering from cancer and having painful sex, just so many really intimate issues. And they weren't talking about them with anyone and didn't even know. So after graduate school, I would get together with my college friends every summer in Boston, and we were sitting at one of their parents' homes, swimming and hanging out. And I ended up summers, maybe 2 or 3 years after I started practicing, with all of them who were asking me about bladder leakage and prolapse. And, at 27, these weren't the conversations we were having back then. And so my friends really called me the Vagina Whisperer and came up with that name. And it stuck. And when I started my Instagram account in 2017, pregnant with my second son, it was really for my group of girlfriends. And it was just to share pregnancy and postpartum tips. And I was writing the same emails to them over and over. And I just said, let's just put this on social media so they can find it whenever they need it. And the growth of the Vagina Whisperer online and on social media is really just a testament to, I think, how much women want and need this information. We're not getting it from our medical providers. We often feel like we're getting it later than we wish. And so I really attribute all of that to, how much we need to keep having these conversations about our pelvic floors and really demystifying this part of our body.
Yeah, and I love it. And I really appreciate how I think the way that you put information out tends to be really approachable for people. I love that about your book, that I can hear your voice. And it's nice because I do think that a lot of times pelvic floor problems are kind of discussed more in the quiet. People suffer, I mean, we know as therapists, people suffer for, years and years and years, not even realizing that there's hope, that there's help available. So let's talk pelvic floor health first for a little bit. Talk to us about, when it comes to the pelvic, what are some of the biggest things, I think, as a pelvic you tend to see people coming in for? What are some of the common pelvic floor
It's like a hammock. And inside of that hammock are your reproductive organs, like your uterus and ovaries, and males, the prostate. It holds your bladder, which holds urine, your balls, which holds stool. And there are openings in this group of muscles, one for urine to exit as a urethral sphincter, one for the vaginal opening, and one for the anal opening. So there's 3 openings. It supports your pelvic organs. It contracts and relaxes with breathing, with movement, with standing, with coughing, with exercise. It helps us use the restroom. During menstruation, we're able to, eliminate it, and also ensure menstrual hygiene products. I think the pelvic floor is often just thought of as the vagina in kind of the everyday world, but it's really this complex, sophisticated group of muscles. So when there is what we call dysfunction or something's not working optimally, you'll see bladder issues like leakage, incomplete emptying, difficulty starting your urine stream, or pelvic organ prolapse, where those muscles aren't supporting the bladder as well. You'll see bowel issues like constipation. Folks don't think that constipation is a pelvic floor issue, but it's the most common GI complaint in the US, and your pelvic floor plays a role. Fecal leakage. The most popular blog post on my website right now is called "Skid Marks in Your Underwear?" Because people don't realize that these are issues that are really quite common, but they don't think of the muscles as the culprit to leading to them. And then other issues like, sexual health symptoms, painful intercourse, difficulty having orgasms, variety of things. So there's just so many different functions of these muscles, and when something's not working well with respect to support, bowel and bladder function, sexual function, your pelvic floor muscles are likely a component. It may not be the initial cause, but it's definitely a component that needs to be addressed.
Mm-hmm. It's funny enough, my most popular blog post, of all time, is one that I wrote called "Where's the Food?" Right. So clearly, people are having food problems out there, right? But I think that it underlies the fact that it is so popular, most popular blog post. It's that are talking about. So they're like, I can't poop. What do I do and stuff. And so how do you think we, with all these problems, because they are so private, because they tend to be things people don't talk about, how do you change that narrative, and how do we start?
Issues, but particularly they're more common in women because of different life stages and experiences that we go through, which I'll discuss. But I think the hardest part is that we need to start talking, having these conversations openly about what is going on is the first step. We don't even know what our normals are. We don't know that a little bit of leakage isn't normal. That pain the first time you have sex isn't normal. That painful periods aren't normal. And so when something arises, we don't know whether it's normal or not. And then we certainly don't know where to get help for it. And so I think talking openly about what our normals are, that's what I really hope to accomplish with Florida, that nobody tells you how often are you supposed to pee? How do you pee? How do you poop? What is an orgasm? How do I know if something's off? And so I think a lot of it is educating folks about the 101. And then when an issue does arise, what are some tips and strategies we can do to help? So I think that's the biggest part. But the other thing is, I think as women, as pelvic health professionals, we're really trying to elevate this conversation. But the healthcare system and medical providers and other aspects also need to get on board. I mean, as much as I want this to help a lot of women and their bodies, I also want medical providers to understand what the pelvic floor is, how to screen for dysfunction, how to refer their patients and get them appropriate care, because they're still being dismissed in the medical care system, and it absolutely needs to change. So it's a bottom up and a top down effect.
Yeah, and I think it has to happen from both sides, because I think that, when we start to normalize conversations with each other, that alone makes a difference. I remember back, this is probably 10 years ago, I was working with a couple patients who, it came out as we started working together that they were friends. And I found out that, they were both mentioning stories and telling me the other person, and they had new names. And I was like, y'all are good friends. They were college roommates. And it was so funny because at one point we were talking and I said, I was like, do you ever share? We were talking about how common pelvic floor problems are and how we need, more awareness and all this. And I was like, do you ever talk to your friends about your own journey and stuff? And she was like, no, I don't, but I should. And I was like, you might find when you talk to them that problems are way more common than you think. It was so funny because like the next week they came in and they were both like, oh my gosh, I had no idea you saw her too. But it was an interesting reminder because I think that, when we start having those conversations with each other, that's when suddenly people start realizing that they can get help.
Yeah, and these conversations are hard. Yeah. I mean, they're not easy to have. They're intimate, they're often embarrassing, and I think that but the more that we talk about them, I think that it kind of normalizes them in a way. One of the reasons people are like, how did you start doing this? Or what got you into this? Like, you can't, at least myself, I've been working in this field for 18 years. I mean, it's like a dinosaur in the pelvic health world. And you can't work with women day after day, week after week, and hear how much they have been suffering, how long they have waited to get help, how much they wish they could have had these resources sooner, and not think like we have to do better. Like, these people deserve better, and why aren't we giving that to them? And I just found it so disheartening and upsetting and thinking like, why am I the lucky one who got like all the good vagina tips? I'm like, everybody deserves that. And so I really think that that's part of this, is just kind of normalizing how we talk about these things. Like, just as we educate young kids on how to potty train and how to brush their teeth, we should be learning these pelvic health education tips as part of just general health education, instead of making them so kind of secret and private.
I 100% agree, because I think, kids are amazing. And I think, when things are normalized to children very early on, then it becomes less of a conversation that has to take place at a very specific time. And it's more than, it just becomes, who they are. I mean, my daughter calls her body parts by their names. I mean, she'll be like, my vulva's a little irritated today. And she knows what to do about it. You know what I mean? And like, I want that for all children, for young girls to be able to know their bodies, and to, for all people to know their bodies.
Yeah. And I mean, I think that that's what I really hope, comes with Florida, is that if we don't understand our bodies, it's hard to teach the next generation about theirs. And so I hope that this is a really kind of interesting, entertaining, opportunity for people to kind of understand their bodies and not make it so mystical.
Yeah, I love it. Now, talk to us with Ford. How did you decide what you wanted to include in it? Because the reality is that, there's so much we could talk about from pelvic floor standpoint. There's, we talk about the pregnancy, postpartum, menopause. How did you determine what you included in the book?
When you go to a bookstore now and you go to kind of the health and wellness section, or what they call the women's health section, and you start looking at the books in that area or in that section, it's like there's some about menopause, there's some about yoga, nutrition, meditation, but there are barely any, if any, on the pelvic floor. And I was like, there is no just basic guide to help us start somewhere. And so before I kind of said, okay, I can do one about birth, which I'm really passionate about. I can do about menopause, which is like on the horizon for me. I was like, we just have to have a baseline. We have to lay the foundation for understanding this part of the body. So I knew I wanted to kind of include everything. The way I structured the book was kind of opening it up with like, why is this necessary and why now? I think there's a lot of like health and wellness trends coming out that are not always evidence-based. I think there is a fire hose of information coming at us on social media and on the internet, and we don't always know what's accurate and what's not. And so I think being able to just give folks a place to start is important. And then I go through different systems like, bladder problems and pooping problems. And then I go through seasons of life, pregnancy, postpartum, perimenopause, and then other things like sexual health and pelvic pain. So I really kind of just wanted to hit everything, where you can read the entire book, or you can cherry pick, like, if I'm pregnant, I kind of want to know what to do now, how to prep for birth, and then postpartum. There were some things that I left out, and I think the reason for that is I just don't have as much experience in those areas, and I felt like touching on them or trying to write on them would do a disservice to those communities. So for pediatrics, I don't have a lot of experience. Working with trans folks, I don't have a lot of experience. I do treat male clients and always have, but I really wanted a book for women. I mean, I just did. I feel like when I was speaking with my editor, she's like, guys have a lot of books, Sarah. Like,
It's your passion, you know?
she's like, what about just one for us? And so I was like, you got it. So I just, I wanted to do justice for us and just give us a starting place. And again, this is my first book, hopefully not my last, but I think that, the information in there is, digestible, and also includes a lot of patient stories to help humanize these experiences and also give you a lot of hope that no matter where you are, like, things can get better.
Mm-hmm. I love that. I was talking with you a little bit earlier today. One thing I think I've always was something I learned from you early on in our friendship and in our partnering together, and something that I've always respected about you is that you always give of your information very generously. I find it in today's age, a lot of times people, want to give a little bit of advice, but not too much advice because they want you to kind of buy the next thing, do the next thing. And as I was reading your book, that came out to me so much because you have these beautiful tracks in there with exercises for people to start on, to where it's very comprehensive and gives people a really nice starting place. So I was just curious if it is something that you just naturally do, or if that is a thoughtful, intentional process in how you give information.
That's such a great question. And I think that it's something I've always naturally done, and now I very intentionally make sure I continue to do. My philosophy on pelvic floor health and education is I don't own this information. I mean, this is something that we learn. I mean, it's like reading and riding a bike, but I don't own that. And I don't feel like it's mine to like keep from anyone. If anything, I feel super lucky that I have this education, and I feel like it's my not duty, but it's my like ability to share that. And why wouldn't I want folks to have this? Because I really feel again like it should just be part of how we're educated about our bodies. I mean, every time I go to the pediatrician with my kids, like I look at all these little brochures, and there's like one on puberty, and there's one on like ADHD, and there's one on nutrition, and I'm like, where's that one for? Where we can just start sharing this. And I've always felt like give, and it's in the hopes that it helps people, and that is really the mission that I have. And I've been really lucky that it's in a book form now or an online workout platform, but it's never something that I intentionally had to think about, but now I'm like, just make sure that I continue on that path.
Yeah. I really love that. And I always just, again, have respect that a lot about you. And I totally agree, and I think as pelvic health therapists, we, in our perfect world, we would love everyone to see a pelvic health therapist, right? Like, I think that we recognize all of the common pelvic health problems that we'd love to have a woman in. But the reality is that not everyone can do that. For some people, it has to do with access, and there's no one nearby who treats them. For some people, it's financial. For others, they just don't want to go see someone, which is also okay. And so I always feel like if we can help people in a lot of other ways and give that information to give them a place to start, it's like saving one pelvis at a time, right?
Many pelvises.
Many pelvises.
I think what's interesting about healthcare right now, the way we've seen it transform over the past 5 to 7 years, is that we have so many avenues and options for access. So it used to just be in person. If you have to go to an in-person therapist or medical provider to get care, and then it became we can do a telehealth session, and then it became you can do online programs, and now it's in a book form. So I think that just giving folks more pathways to get this information is what's important. And I think that this is just another pathway. And books have always been a pathway.
Yeah.
And so I think giving people options to also increase access to this, like it has to be affordable, because pelvic health care is not always affordable or accessible. Not everyone has a therapist in their area, and that everyone has the means to get off of work or get healthcare coverage or whatever the case may be. So and again, I think some people are just curious and they just kind of want to know a little more before they go see somebody in person. So I think that this is again just kind of part of that big picture of how we can disseminate this information and help a lot of people.
I love it. I want to talk a little bit more about like the healthcare landscape. And I wonder if you could speak a little bit on, when people are starting to, when they read your book and they start to think like, yeah, I do have a problem and I need to seek help. What is your advice to someone on where they should start with that? Because I think that must be tricky. I mean, you look and there's like a million different specialties. And it's like, do you go to your GP? Do you go straight to a pelvic PT or OT? Do you go to, you know, the gynecologist? So, you know, what are your recommendations on that?
Yeah, I think, you know, this book is not ever going to take the place of in-person therapy. I don't think anything will. I mean, I think that in-person therapy is hands down going to be the best option. But however, a lot of folks don't have access to that. So in the book, I provide a lot of tips and education and things that you can start doing at home that are, it's not a complete overhaul of your life. You know, I think we have so many things on the to-do list that can feel really overwhelming. Like, oh my gosh, now I've got to like put pelvic floor on my daily list, you know? It's like, but it's not that complex. It's really small changes that you can just build in that can have a really big impact. And then I also think that I also want folks to know that in every state in the United States, you can see a pelvic floor therapist without a physician's referral. And this is important because we can't rely on a different medical provider to know whether you have pelvic floor issues or dysfunction. Like that is what we are trained to do. And if you don't have a pelvic floor issue, then we'll say, this is not the right spot. Let's find you another provider. Your pelvic floor is amazing. So I think it's important to try the things that are in the book. If they're not effective or you feel like you need more, and I say this many times, like see an in-person therapist, or you can try different programs at home. And, you know, or if it's a more complex situation, see a medical provider in conjunction. So it's an and model versus an or model.
I love that. And, you know, and there are medical providers that are so passionate about pelvic health who are, you know, really screening their patients and referring patients and identifying all sorts of stuff with patients. But on that note, there are also situations that we hear every single day of people going in and talking to their providers and feeling really dismissed. You know, I've had so many patients say things like, my doctor said like that's just part of perimenopause, you know, or they'll say things like, oh, you're having painless sex, you should drink a glass of wine before you have sex. Or, you know, I'm not kidding. I hear that one all the time. You do too. Yeah. And so what is your advice to someone who maybe has started to approach this with their medical providers and they're feeling really dismissed, or they're told something like, well, you can, you know, whenever you're ready to have surgery, call me or something like that?
Yeah. You know, I think that, one, I hope that this book also gives folks, yourselves included, the, you know, courage and ability to know how to advocate. Because I often think like we don't know what we don't know. We, one, don't know if this is a problem, and two, we don't know that there's treatment for it and there's therapy for it. So I hope that this introduces that concept. It's really easy for me to say, you know, if your doctor dismisses you and tells you, you know, that this is not a problem, it's easy for me to find a new doctor. You know, that's a really easy thing to say. That's what I want to say. You know? But I think that you have to continue to advocate, and I would try to find a new doctor if it's possible. But I think that the other thing is you can't let that be the end of your story. Like, I am a very firm believer that people know their bodies best. And as a therapist, what I do is I feel like I listen really well, and that the examination I do just confirms or denies what is going on. But most often, I mean, we're not making this stuff up. Like, it's very real and it's happening, and we're just not being heard. And there are many medical providers who are super pro therapy and super collaborative, but I would say that that's the exception and not the standard. And so I hope that as, you know, we really continue to work together and find that, you know, there's such a benefit to, I mean, the research is very clear that a multidisciplinary team has better patient outcomes. And so I always want the focus to be on that. But I also encourage all of you to just, you have to keep advocating. You have to keep pushing. You have to keep finding the right providers. And it's not easy and it's exhausting, but it's out there and you deserve it. And so that is what I encourage you to do.
And I always tell my patients, you know, providers are not dictators. You know, they're meant to be partners in your health. And if the partnership's not working well, there's lots of other options around, you know, and, you know, they are the experts of their body. And so you gotta trust that intuition too.
Yeah, and it's interesting because I think two things stick out to me is that I was pregnant with my first son and I in Dallas, and they're known for having really great, you know, pregnancy care, and I wanted to have an unmedicated birth and have a doula. And I loved my OBGYN at the time. Like, loved her. And at 21 weeks, I went in and I said, you know, I'm thinking about getting a doula for my birth. And she said, I said, what are your thoughts on that? And she goes, I think that they just get in the way. And I was like, okay. And I like, changed my gown and then left. And I called my doula and I said, I need to find a new doctor because this is a non-negotiable for me. And I want to know that my team is all on the same page. And at 22 weeks pregnant, I found a new doctor. And it was like, because I knew, I was like, I have to have folks in the room that I feel like we are on the same team. And I just didn't feel that way after what she said. And I never even had the courage to go back and tell her, which is unfortunate about why I switched. So it's one of those things that you do have to kind of find the right providers for you. And then the other thing is, I think sometimes people try pelvic floor therapy and they're like, I tried pelvic floor therapy and it didn't work. Or I didn't like my provider. I think two things are true with that. That can absolutely happen. Just like in every profession, there are some PTs or some OTs or some pelvic health providers who are not going to offer enough care. But I also think that it's a style, it's a chemistry, it's a mix. Like I had to interview like 3 therapists when I moved to New Orleans to find like my lady. And like, this is my lady, like And so I think the same thing with pelvic floor therapists. If you go see one, we can never promise we're going to cure you, but if you know it's the right pathway for you, and the therapist isn't the right fit, find a new one. I mean, it's kind of like when you try on pants and they don't fit, you're not like, I'm going to stop wearing pants. You're like, no, I'm going to find pants that fit. And that's what I would encourage you to do.
I love that, because I'll hear sometimes patients say things like, oh, I failed pelvic floor therapy. And I'm like, we're not a treatment. Like we're, healthcare professionals. And so, no one would be like, oh, I failed gynecology. It's like, no, you saw one gynecologist who their approach was not ideal for you.
Yeah.
And the same, I think, is true in our world that, if you saw one therapist and their approach was not ideal for you, that, different people practice differently. So I do want to talk a little bit about navigating the pelvic health therapy landscape because it's been amazing in our profession. The growth has been outstanding. I mean, when I moved to Metro Atlanta in early 2015, I mean, I could literally count on one hand the number of pelvic rehab providers and practices and stuff in the area. And now, oh my goodness, there are so many pelvic rehab providers. But I think with that, there's it's popular. There are places that are wanting to offer pelvic floor therapy, but they may not even have trained PTs or OTs providing that therapy. What are your suggestions for people as they do navigate who they see and what they do?
I think that I get asked this question, like, what should I look for in like a quote unquote good pelvic floor therapist? And it's a tricky one because again, it is a little bit of like, what are you looking for? I am maybe of the old guard where if you call yourself a pelvic floor therapist, you have to be able to evaluate and diagnose a pelvic floor issue, which means an internal assessment, which is how we do a pelvic floor evaluation. So there are therapists who say, like, we do childbirth separation, we do pregnancy, which is great. But I'm like, if you're not doing an internal pelvic floor assessment, I'm like, then you're not a pelvic floor therapist. And you can agree or disagree with me, but that's what I would look for. Somebody who can do an internal assessment, who you feel comfortable with, who you feel like listens really well, who is it's a team. You're not the passenger in their care model. You are collaboratively making decisions. And I think I'm also a little bit of a mix of, I like, using some modalities or, gadgets. And I also like doing manual therapy and I like doing exercise. I don't think that any one treatment is like the whole thing. You've got to be able to kind of pull all these different puzzle pieces together. And I also think it's really important for a therapist to be able to say, I don't know. If somebody comes to me and says, like, I've got this really itchy red bump and I'm not sure what's happening, like, can you take a look at it? And like, what is it? And I'm like, I don't know. Like, that's out of the scope of my practice, or I'm not confident. Like, let's refer you out to get more evaluation. So I think somebody who has the awareness and wherewithal to be like, I need help. This is not a muscle issue. This is something else. And so I think that these are the things you want to be looking at, thinking of. And then, but I am someone who thinks that, like, to evaluate the pelvic floor, you need to be able to evaluate the pelvic floor.
Mm-hmm. And it's totally reasonable to ask a practice about the training of their providers, to make sure that people have actually gone through very specific pelvic floor training and, that this is what they do versus someone dabbling,
Yeah, and I think you'll know a dabbler.
So going back to Ford, you made a comment a little bit earlier where you said, sometimes there are just little things that people can do, that it's not necessarily like you have to do this huge comprehensive program to make a difference in your pelvic health. I know in Ford, you share a lot of different tips for pelvic health. And I was wondering if you could share, what are some of your favorite little tips, little changes that make a big difference for someone's pelvic health?
Absolutely. In the last chapter, I actually give like the 10 things I do as the Vagina Whisperer. And I think it was actually really vulnerable for me to write because the entire book I talk about my patients and how I treat them, but versus like, what do I do like in the privacy of my home that is meaningful for me and really important. So some of the kind of standard ones are like when you pee, I don't push when I pee, like ever, ever, ever. I remember being in grad school at WashU, and we had our one of my professors was a pioneer at the time, is still a pioneer, and she gave us a lecture on like how to pee, and I was like, I've never thought about how to pee. And so in between classes, we all go to the bathroom, and I hover over the toilet, and I just like push as hard as I can, and I'm like, holy shit, I've been peeing wrong all the time, like. And then, so now I'm like, okay, Sarah, you're doing it all wrong. So now, all of these years later, I like never push when I pee. Never.
And you sit, you don't hover.
You sit down,
yes.
You lean forward, take some deep breaths, and your bladder is a muscle that pushes the urine out for you. So you don't have to push. Pushing will weaken your pelvic floor muscles over time. And if you pee 6 to 8 to 10 times a day, those things start to compound and can lead to pelvic floor issues. So don't push when you pee. I always use a squatty potty when I poop. Like when I'm traveling, it's like trash can on the side or luggage under my feet. When I like gave birth, it was like, give me that laundry cart that's going underneath my feet. Every bathroom in my house has one. I have a travel portable one. Putting a stool under your feet when you're pooping helps put you in a squatting position, which relaxes your pelvic floor so that you can empty better without straining. Straining during bowel movements can weaken your pelvic floor more than coughing, laughing, jumping, crunches. And if you strain with bowel movements every day, I mean, we see so many people who have pelvic floor weakness or prolapse because of constipation. Even young women who have never had kids, they're like, why do I have a prolapse? And like, you've had chronic constipation for years. And so learning how to poop properly with your feet elevated is really important. I do pelvic floor exercises. I do my homework, and I didn't always. About a year ago, I started playing tennis at 40. I'm 42 now. But like right after COVID, I was like, I want to be outside and I want to be exercising. And so I started playing tennis. And I was at a match about a year ago that I had on like hot pink leggings, and I like did a quick step for a ball, and I was like, oh, I think I just peed. And I felt it, and I was like, oh my God, I just leaked. I was like, I'm the Vagina Whisperer. Like, this is not good for my brand, And then the whole rest of the match, I was like, oh my gosh, can you see it? Like, is it happening again? Like, what should I do? Should I go to the bathroom? And it was ruminating in my mind, and I lost the match. But it was like at the age of 41, I started having pelvic floor problems, and I had never had that my whole life. And so I started doing my pelvic floor workouts, and it has been a year of like just exponential improvement where I have so much more strength and a better contraction. I was like, Sarah, you have to practice what you preach. So I started doing my pelvic floor exercises. I use a really good lube. I recommend that to everyone. And those are probably some of the other things. And I pay attention to how I sit. I would say like, yes, I'm sitting with my legs crossed, but I know that like slouching isn't great for hip bone pain, or resting on one hip all the time. I try to like shift my weight and cross my leg the other way. So just kind of being aware of my posture, which I think people don't realize can influence their pelvic floor tension or length and strength. So those things are important.
I love that.
And you and
I do. I would say I do all those exact same things. I think the other thing that I do is I try to be really proactive with addressing any challenges when they happen.
Yeah.
Like if something is feeling weird, I take care of it immediately, and I try to just, like figure it out. If it's like, oh, I'm having like a weird pain, or I peed on myself, and I'm like, what happened? Okay, I was sick. I was coughing a lot. What's going on with my pelvic floor? For me, I'm actually prone more for pelvic floor tension. And so usually for me, I'm like, you've been stressed out. You need to relax because your poor pelvic floor is like, help me, use some time to just like stop clenching all the time, you know? And so for me, I'm like, just you need to take some deep breaths. You need to like relaxing a little bit and stuff. So that's that is the other thing. And I will say, I often do, knowing that I'm prone to tension, I do pelvic floor check-ins for myself all the time.
Yeah.
And so I'll be like working, and I'm a quick check, and I'm like, okay, relax your pelvic floor. Take a couple deep breaths. We do not need to be clenching our pelvic floor just because of this email that I'm trying to go out, you know. So that's my other one.
And you know, the fascinating things is like these are everyday things we just don't know that we should know. Like people were never taught how to pee or poop or sit or even breathe or how to exercise. And so I think it's just super enlightening once we learn them. We're like, huh, I didn't know that, you know, and it's just really so basic.
Yeah. Yeah, and you know, it's, I'll add with the constipation thing. So constipation truly is like the root of all pelvic floor evil. Like constipation will worsen everything, like literally everything.
Yeah.
Like, oh, you pee in your pants? Constipation will make it worse. Pelvic pain? Constipation will make it worse. Like all of the things. And so the other thing I think for me is that I do not ever let myself get constipated. If something is off and I'm constipated, I'm going to handle it immediately and get myself pooping again regularly, because I just know that constipation tends to lead to so much other discomfort, honestly, in the body.
Yeah, it's interesting because I think sometimes folks will say like, oh, I'm leaking, and they'll come in for talking about like, I've got some stress incontinence, or I leak when I, you know, jump, and I'm like, okay, let's talk about your bowel. Like, no, I'm here for like bladder stuff. Like, I know, but they're so connected. So connected. And I think once people can put those pieces of the puzzle together, it just makes a lot more sense.
Yeah, 100% does. Okay, we're gonna get to questions in just another minute. I was wondering though, before we jump to questions, if there is a part of your book that is particularly meaningful. I just think it would be really special if you would feel comfortable just reading like a little segment or something to all of us while people are thinking of their questions they want to you.
Yeah, I would love that. So I think the first chapter and the last are my favorite too. And then so let's go to and I really hope that you love this book. So I'll read you a portion.
You won't love it.
So here we are. Okay. I am a physical therapist whose practice is based on optimizing movement, improving posture, and utilizing exercise to give our bodies long-term relief and function. The tips and protocols provided in this book are not magic pills and likely won't give you immediate relief. They take time, patience, and consistency, but they are effective. And once implemented, you'll see incremental improvements that will benefit your pelvic floor throughout your entire life. If you feel you need more than what the pages of this book can offer, pelvic health therapists are located throughout the United States and the world. However, there is simply not enough of us. The United States alone has over 250 million adult women and fewer than 10,000 pelvic floor therapists. You won't find therapists in every town or city, and they're even more rare in rural areas. Although the number of us are increasing, we need more to provide all women a good standard of care. Not to mention, in-person medical care can be costly, distant, or simply unavailable. The good news is, with this book, you now have a menu of options to address your pelvic floor needs and the language for reaching out for pelvic floor care within the medical system. You can do a telehealth session, an online exercise program like mine, or a group workshop. You have options. Often symptoms of pelvic floor issues persist for years before women seek care. So one therapy session or 1 week of exercise is not going to give you the immediate relief you desire. But as I always say, you have to learn to walk a mile before you run a marathon. Stay consistent with the small habits and simple exercises provided in this guide or by a qualified pelvic healthcare professional, and progress is possible. And one last note worth mentioning, your pelvic floor deserves healthcare, not just the hot new wellness trend you heard about from a friend or saw on social media. Not every pelvic floor trend helps or even works. From a jade egg that promises magical pelvic floor powers, to a laser wand that assures a rejuvenated vagina, to a fitness professional who offers a weekend course and claims expert status on how to tighten your vagina. These options promise quick fixes, are not always backed by science, and are often not coming from qualified practitioners. I'll say it again. Pelvic floor care is health care, not wellness and not even fitness. More women experience urinary leakage than diabetes, hypertension, or osteoporosis. Yet women are less likely to receive treatment for pelvic floor disorders. 75% of pregnant and postpartum women and 68% of postmenopausal women do not feel adequately educated about their pelvic floors. Women know more about erectile dysfunction than pelvic floor prolapse. It's time to bring pelvic floor education and awareness out into the open and keep it there. Start and continue the dialogue around the issues raised in this book to normalize pelvic floor conversations instead of normalizing pelvic floor problems. If you're a medical provider, ask your patients about their pelvic health. Inquire about leakage, bowel movements, menstruation, menopause, and sexual health. Research clearly shows if we don't ask patients about their pelvic health, they are likely not to tell us. So it's on us as their providers to ask the questions and refer them to pelvic floor therapy if they're experiencing or simply want to prevent an issue. I hope this guide not only floors you with the magic of your body, but also empowers you to take fabulous care of yourself. You get one pelvic floor, and you need to love it, claim it, reclaim it, talk about it, ask questions about it, and keep it in the spotlight. Reading this book may be your first step or your 50th in your pelvic health journey, but I hope it's certainly not your last. You deserve a healthy pelvic floor throughout your entire lifetime. And the power to achieve that is not just within the pages of this book, it is within you.
So we have some great online questions, and I'm
Beautiful.
sure some of y'all as well. So, all right, I'm going to come to you. I'm going to start out with an online question just because I think it's probably a good starting place, which is what actually happens at your first pelvic floor appointment, and really like how invasive is it? So can you just like talk about the exam, talk about like what kind of treatments happen on the, like for someone who's maybe a little nervous, like what's the initial thing like?
It's great. It's like you don't really know what to expect. So I don't love the word invasive, but it's kind of, I mean, what I would say is when you go see a pelvic health provider, it's in a private treatment room. So it's not out in a big therapy gym with lots of folks walking around. The initial session is typically about 45 minutes to an hour. You will start by sitting down with your therapist, and they'll ask you a lot of questions about all of your pelvic health symptoms or history. So again, you may be there for leakage, but I want to know about your childbirth history, your exercise, your bowel routine, everything. Then we will do an external assessment. The thing I will say is everything is with consent. So nothing happens without checking in with you and explaining it to you first and then asking your permission to proceed. And then you can stop the examination at any part. So we'll do an external assessment, maybe look at your low back, look at your hips, check your pelvis, your abdominal wall for any scars or abdominal, core strength or separation. And then we'll do an intra-pelvic examination. What this includes is you will be undressed from the waist down. So pants and underwear off, and you'll be draped with a sheet or a gown. So you're not in stirrups or anything, you're kind of lying on a mat. And then we look externally outside the pelvis, so at the vulva, and we're looking for skin irritation or any scar tissue. We'll ask you to do a couple things like squeeze, like you're doing what you would consider a Kegel contraction, and then relax. Push out like you are pooping or trying to birth a baby, and then relax, cough, and we just see how the muscles are responding. And then we'll press externally around the muscles to see if there's any tenderness or tightness. And then we'll do an intravaginal assessment with a gloved, lubricated finger inserted into the vaginal opening, and then repeat that process. Squeeze, relax, push, relax, cough, and then press on the muscles on the sides to see if there are tenderness, tension, recreation of your pain. And then you can do an intraanal assessment as well, intrarectal, but it's typically the first option is vaginal if it's available, or if it's in a male body or someone who doesn't want an intravaginal assessment, you can do intrarectal, or you can opt out of it completely and you can wait. And you can say, I don't want to do it. And we're like, totally fine. Let's work on some external stuff. With the information we gather from the muscles, along with what you're coming in for, the symptoms you report, we're able to create a pathway of, is it a maintenance issue? Is it a tension issue? Is it a coordination issue? And then we can start a treatment plan. And usually you see a therapist once a week, maybe for 4 to 6 weeks, and then you kind of decrease frequency as you start to see improvement. And then you get lots of like to-dos between your sessions to continue the work at home.
One thing that I'll just add is that, I know for some people, the idea of an internal exam can feel really intimidating. And it might even be a reason why someone would not seek care because they're afraid of the internal exam. While we do believe that the therapist people should seek out are therapists who have training in internal evaluation of pelvic floor, because that's best practice. And you want to see an expert, you want to see someone really knowledgeable. I always tell the clinicians that I mentor that the decisions for how we examine patients should be altered and changed based on the conversation with the patient versus the skill of the therapist. What I mean by that is that, I want my therapist to be trained in doing all of it. However, when we sit down with a patient, sometimes patients, we have patients who are nervous. I've had patients who come in and they really, the idea of an internal exam is like a big no for them. We treat people with trauma histories and other reasons that they might not want an internal exam. And that is perfectly acceptable. That most practices, especially, I know I speak for mine, I speak for, I know I speak for Kemper as well. We really, really strive to be really trauma-informed practices, patient-centered practices. And so, it's a conversation of like, hey, these are the options for how we could examine you today. What feels good to you? What do you want to do? And if a patient says, I really am uncomfortable with internal, cool. We can do all sorts of other things and look at your body in different ways and modify a plan. And that is also very perfectly acceptable.
So I always say it's like peeling layers of an onion. Like you can start externally and there's so much to work on and don't have to do internally if you opt out of it, or you can decide when you're ready.
Yeah.
Awesome. All right, we have an in-person question.
So ladies, I am here tonight because we had a girls' weekend and I told them about my pelvic problem. And they suggested we come tonight. Yeah. But I'm one of those that has been through a lot of different things. And one of the things that I have noticed is that in France, they do allow 10 weeks of pelvic therapy post-pregnancy. So prior to having, or right after having my daughter, I knew something was not right. And I asked and I asked and I said, I need pelvic therapy. I think I need pelvic therapy. Mm-hmm. And until I actually had problems, like full-on problems, I could not get it. So I'm curious is if either of you have seen any studies that show that post-therapy has been helpful for those women and they've had less issues later on.
Yeah. So one, I'm super sorry that you had that experience, and it's unfortunately quite common. It's really confusing for me to understand why you would deny someone a referral someplace that has there are no negative side effects to pelvic floor therapy. And I hope that we continue to see this improve, where if someone's asking, they get a quicker referral. And you're correct. In other countries, in France in particular, it's the standard of care to get postpartum therapy, and they absolutely have better outcomes when you seek pelvic floor therapy early. And what I typically tell people is that if at 3 months you're still experiencing an issue, it's likely to not resolve by 12 months. Because a lot of this, we're like, oh, I'm leaking, like, look at that, let me give it time. But if at 3 months you're having pain with sex or urinary leakage or prolapse, by 1 year, that will just resolve on its own. So there was actually a fair bit of research to support postpartum pelvic care and the improvement of back pain, urinary leakage, prolapse, return to activity, return to work. I mean, all of these things. So it's really challenging as to why this has not been integrated more into our healthcare system. And I think we're working on it. The American College of Obstetrics and Gynecology, which is the governing board of all OBGYNs, when I looked at their programming the past 2 years, there was not a single pelvic health conversation on there. And I applied, which is, like, where do we start? Like, how do we start bringing them into the conversation, just piquing their interest a little bit of like the benefit their patients can have by coming? And I was rejected. from coming. And I'm like, how do we? So you have to, start somewhere. But we are working very hard to try to educate and inform new generations of providers to be able to put pelvic floor therapy, not even just postpartum, but even during pregnancy, as part of their care plans. But there's absolutely a benefit. There's absolutely research to support it.
Yeah, and it is sad, honestly, that it's not. I think that referrals postpartum should be fairly standard practice, honestly. But it's interesting. So I do think there's providers who are trying to shift that a little bit. It's funny, at our practice, we get a lot of referrals from actually a pediatrician. And it's so funny because I met with her and she would refer over patients for postpartum rehab. And when we first started doing the referrals, we were like, oh, pediatric practice. And we have pediatric therapy. So I'm like, oh, it's a pediatric patient. And then we kept calling and it's postpartum moms. And I was sitting down meeting with her one day and she was like, yeah, Jessica, I just have started referring patients postpartum because they're not getting referred by their OB-GYNs and someone's got to do it. And it was so funny. She's like, I can't remember, like, no pediatrician. She's like, so I just screen them all when they come in with their babies and refer them so that they can get care.
Yeah.
Like, maybe that's the route we need to go, is going to the pediatric conferences.
Yeah, I mean, we'll go anywhere.
We know.
I will say, I'm working at, I live in New Orleans, and, LSU, I had one of their residents reach out to me recently, and we're coming up with a screening tool so she can screen for postpartum patients because she's like, and they don't even know the questions to ask. I mean, she's like, do you have a pelvic floor problem? Like, that's not the question. So it's like helping them kind of discern, like there's interest there, but there just isn't the training and the infrastructure to help them get the patients where it needs to be. So it is, but what does help is when a patient goes back to their provider and say, hey, I went to therapy and this was really helpful for X, Y, and Z. If any other patients present with this, I really think that this could be a good avenue for them. And that goes a really long way.
Yeah, and I think the new generation of doctors coming up too want to do better for their patients. I lectured at Emory's OBGYN residency program a few months ago, and it was really interesting because afterwards, 3 different residents reached out to me and wanted to come shadow the clinic and wanted to, and one of them said, I want to be able to do better for my prenatal and postpartum patients. And I feel like that's, it's huge. It's like so happy to see those changes.
We have a couple of quick logistical questions, and then I'm going to come up and get you. Is there a specific height for a stool for bowel movements?
7 inches minimum.
All right.
But honestly, you can just use, your knees have to be above your hips level. So it depends on the height of the toilet and the height of the person. Your squatty potty that you can buy online is 7 inches, but like for my nephew, who I just sent him one, he has a 9-inch one because he's a little bit shorter. So it really depends on the height of but 7 inches is kind of the standard online.
But this one caveat with that is that you need to be comfortable and you need to be able to relax. And so if for some reason 7 inches feels pinchy at your hips or hurts and you can't relax, then a shorter stool would be better for you so that you can relax your pelvic floor.
Someone says my urologist is recommending a quote magic chair with magnets.
Yeah.
And is supposed to tone my pelvic floor. Is this true?
It's true that they're recommending it.
I think she's wanting to know. Yeah.
So there is no magic pill that is going to fix your pelvic floor problems. And typically these issues have been prolonged. It's not like the first time you meet. It has taken you a while to get there. And, these chairs the research is really short term. They'll say like, oh, you do it for 30 minutes a day, and I actually talk about this specific device in the book because it's costly. There are no studies to show the long-term effectiveness for it. And if you haven't had your pelvic floor evaluated, you don't know if your pelvic floor actually needs strengthening. It could, in fact, need relaxation and lengthening, and this device could actually make your symptoms worse. So I would encourage, unfortunately, against it. And I am going a route that may be a little bit more time intensive, but much more effective in the long
run. And then this person just has a question about terminology. Does a dropped cervix press on the bladder, and is prolapse the same as cervix drop?
I've never heard cervix drop in particular, but you can have a cervical, like your cervix can prolapse, which is, so to back up a little bit, prolapse is when we think of this hammock supporting our pelvic organs. If this hammock gets weak, gets lengthened, if the ligament supporting the organs gets stretched out, those organs will start to drop down and push into the pelvic floor, which is the walls of the vagina. So it's not that like your bladder's falling out, it's that your vaginal walls are being pushed in by an organ. And this is typically your bladder in the front wall, your rectum in the back wall, or your urethra in the front wall. And then if you have a uterus or cervix, it's from the top. Like think of the pitch of a tent coming down. Now the cervix is the opening to the uterus. So ultimately, if your cervix is prolapsing, your uterus is prolapsing, unless you don't have a uterus and just have a cervix. So it's likely an indicator of a prolapse if your cervix is dropping down and protruding into the vaginal canal.
And I would say that prolapse can contribute to some bladder symptoms in a variety of different ways. So if you know that you have some uterine prolapse, you're having some bladder symptoms, they could be connected. They could not be connected. There's a lot of other things that contribute to bladder problems as well.
All right, we have a little question.
Hey,
Hey.
I had a quick question, and I'm really excited to be here and excited to hear more about your book, my dear friend Bridget. I do a lot of things, but one of them is like being an abortion doula and supporting folks navigating abortion access here in Georgia. There's been times in the past where like folks that I've supported have come and been like, oh, I think I'm having X issue with my pelvic floor. And a doula is a non-medical support person. So I'm very, very unqualified to support you through that, but think you should go see a pelvic floor therapist, which is typically what I recommend. My question is, a lot of times the feedback is like, oh, my insurance doesn't cover it, or I'm unsure where to find one, or I'm unsure like, is there any differences between like what an OT can provide and a PT, and all these like niche questions that again I'm not qualified to answer. So I'm curious, like if y'all wanted to speak to any changes you've seen in insurance coverage around pelvic floor therapy over the last like maybe decade, I think is like the frame that you've used a couple of times. And then just any suggestions that you have around possibly getting treatment covered, or things you've seen patients be successful with trying to get their insurance to cover it.
I'll touch on the insurance piece first. So in healthcare, is what we call in-network, which means you're covered by an insurance carrier, or Blue Cross, UHC, Aetna, whatever. So as a provider, I'm contracted with them. And then there's something called out of network, which means I am not contracted with them. So if you go to an out of network pelvic health therapist, it's we don't bill insurances, so it's kind of cash pay. Like you pay what the cost is on their website or whatever. So say it's $100 to see Sarah, that's what it is. I don't take insurance. I do print you out what's called a super bill, and you send that into your insurance for out of network coverage, and every insurance claim is different. It's kind of like Jessica could have a $10 copay and I have a $20 copay, or she has $100 out of network deductible and I have $10. So it varies, but you can submit these out of network charges for some coverage to your insurance, but it's on the patient instead of us as the practitioners doing it. The other thing is that there are pelvic health therapists that are in network, and we fall under regular physical therapy benefits. So if you go see someone because you have a knee injury and you go to physical therapy, you may get like 20 physical therapy visits. Pelvic health therapy is the same. It's billed the same. So you may have it. It's not that public health therapy isn't covered. It's that some providers are not contracted with insurance companies. And one of the reasons for that is that, to be very honest, is that insurance companies can squeeze the life out of you as a healthcare provider. And it's really hard to offer the quality of care that we do in a one-on-one setting in 45-minute to an hour sessions with working with insurances. And some big clinics and hospitals have found a way to do it, but smaller practices like mine and Jessica's and Kepler's, it's like not possible. And I think to have healthcare providers who take their time with you. Their hand is not on the doorknob. You have access to them. It's unfortunately they have to be out of network for some places, and there are great therapists in network, and there are great therapists out of network. It's just these are the reasons that I think some providers are out of network.
I would say, when it comes to coverage, I always tell my patients that when it comes to insurance, the persistent bird gets the worm. And what I mean by that is that, because I'll have patients that will submit a claim with their insurance company, and the first thing they do is try to just deny the claim and deny coverage, hoping the patient's just going to be like, oh, okay, and move on. So I always tell them, like, you got to push. You can push. And I mean, I've had patients who come to our practice who've gotten us covered with in-network benefits because their insurance does not have a well-qualified provider in network who's providing this type of specialty care that they need. And I find that when they do push and they keep pushing their insurance company, sometimes that's when they're able to get the coverage.
But this is the thing, like, I actually think about long term is like lobbying for better coverage for pelvic health therapy and making this a separate billable charge versus just regular PT where you can see 3 people in the gym at the same time. Yeah. So I think that, like, in the future of where I see pelvic health going, it's like trying to get insurance companies to recognize that this is a different specialty and a different type of treatment versus, being in a gym. And so I think that could be a really great pathway to increasing access.
Can I just ask one quick follow-up? That's what the folks online can hear. I'm just going to scream it out, but it's not do you feel like since you began, it has like improved in like the ability to like push back on your insurance or like get things approved?
No.
Okay.
It's still a problem, honestly. It's a huge problem, and people have to really advocate for themselves, which is unfortunate.
But what I will say is that I think with pelvic health therapy becoming more well known, more in network hospitals and clinics offer this. So it's like there are more options. There's more options. So some are out of network, some are in network, but there's more in insurance companies as well, even though there's some outside.
Yeah, that's true. Thank you.
Thanks for asking.
Okay. I was wondering, as a parent, what did you guys, because it sounds like you kind of came into this before you had children, but have you heard from patients or other parents, I'm sure, as they get to know what you do and they're like, oh, okay, well, what do I need to know as a parent to kind of, like you said, we use, the appropriate names for body parts and things like that, but how do I help so my kids don't go, man, I really wish I had known that coming into puberty? Or, gosh, you even said you see pediatric cases. What are things that I could help them know what's normal now as opposed to later?
I think you being here and proactively thinking like, we don't know what we don't know. And I think that at every stage of life, we're discovering new things about being a woman and having a vagina and having this anatomy that we just wish we would have known sooner. I really hope that before you get that baseline, because again, we can't educate our kids if we don't know. Like if you have a young daughter and they're learning how to insert menstrual hygiene products, like there are young girls who are inserting tampons in their butt. Like they don't know that there are 3 openings and there's a vaginal opening. So not even just the mechanics of using a menstrual hygiene product, but like the actual hole it goes into. And so I think it's the most common question I get. It's probably my most favorite. I started this book with anatomy and physiology, but also with menstruation. And I think because we get period education, we maybe get sex ed, depending on what part of the country you live and where you go to school. And it's like sperm meets egg, baby, and like that's not really sex ed, And but we don't get pelvic health education. And what I really think is helpful is to not sit down and have one conversation with your kids, but to trickle in this information over time. Like just when you are potty training your kids, you're like, okay, don't push, buddy, just like take some deep breaths. And like, after the age of 6 or 7, I'm like, you don't need to be going just in case anymore, right? Like teaching them, the things that we need to do ourselves with bowel movements. Like my kids have a stool in every bathroom And we've been on vacation. I'm like, put your feet on my thighs. Like I'll squat and like lift those knees up, buddy. You know, I got you. But it's like just teaching these things as part of their own, body. And I think that also having these conversations and using the right words and answering their questions when they come up is how we make these issues less private and more health oriented. So cracking the door by talking about these things is what we want to do, so that if they do have questions, they come to you and we don't dismiss them. I think it's so often it's like, my vagina hurts. It's like, don't talk about your vagina. These are private parts. We don't talk about that. Or like, I do like my kids. I'm like, put your penis away at the table. We're eating dinner. But it's like we call the names. And even for me, it's like, I probably have less boundaries than most home, but like they see me go to the bathroom, they're like, what's that string coming out of your butt? I'm like, it's called a tampon. And they'll be like, what's it for? I'm like, well, mommy has a period every month, and this is what this is. And it's when the uterine lining sheds, when there's no implantation, for a baby. And so I'm like literally answering their questions. And they're like, does it hurt? And I'm like, no, it doesn't hurt, And so I think it's really easy for us to be like, oh, we don't talk about that. Or like, you don't need to know that because you're a boy. But I think we answer their questions because if they don't come to us, they're going to go to somebody else or find it somewhere else, which you could find all the information online. But two, you don't have to keep going though. I think we do age appropriate responses. And then and then sometimes it's like, what is this? And I'm like, oh, it's this. And they're like, and then they stop asking questions, And so I'm like, okay, I quench their curiosity, but I want them to know they can come to me and answer and they'll get answers.
Yeah. And I think too, when we do give them little bits of information along the way, it tends to make those conversations just so much easier. They don't have to be, for my kids, like there's never this big conversation of like how babies are born, because my kids know that they were born via cesarean because they've seen my scar, and we talked about it, and and it was very, very early when we were talking about it. And I was like, well, some babies are born from the belly, they have scar just like me. Some babies are born, they come out of the vulva, out of a tube called the vagina, and they're like, huh. And it was funny because, any of you who know my husband, he's so funny because the poor guy's married to a pelvic PT. So I was like, oh, anytime they ask this, he's like, are we having this conversation? I'm like, sit down. But it helps those conversations because then there's nothing weird about it, and my kids will literally be going to bed and suddenly one of them will be like, you never thought about it? I think I want my babies to come out of my vulva. And I'm like, okay. I was like, well, so did I, kid. So I'm like, well, all right. But I think it's normalizing it and normalizing simple things like even just talking about bowel and bladder stuff with your kids. I know so many parents who, we'll see, we treat pediatrics, and so we'll have kids who come in who are really constipated, and the parents have no idea of how big the problem was, because once their child was able to wipe, they started having no more conversation, and they're like, oh, they go every day, and they didn't realize what was going on. And so just having conversations, even with my little kids, if they poop and their poop looks hard, I'm like, oh, your poop is a little bit hard. There wasn't very much of it. Have you been drinking enough water? I don't think you've had very many vegetables today. Like, we need to increase how much fiber we're eating. We need to drink more water. And now my 6-year-old, she will literally come out of the bathroom and she's like, Mom, my poop was hard. I think I need to drink some more water. Yes, you do, my friend. So it's just like all those daily conversations.
Yeah, I just think it doesn't have to be the one conversation. I think, and even when you're, you get whomever, if it's you have a young, daughter or woman in your household who gets their period. Women don't know what their period is. Like, they don't know that they're literally like, there's a buildup of the lining during the month. And you're going to have over 400 periods in your life as a woman, and you don't even know what it is. And I think it's not that it's our fault. We just have literally never been informed. Period education for me was like a box of tampons and me sitting on the toilet at like 11. And I was like
the instructional book.
Yeah. Well, like the instructional book, I'm like, TSS, that sounds I could die by using these, just like we would talk to them about like skincare, like how do you take care of this part of your body? I think one of the biggest challenges outside of just kind of feeling uncomfortable with the conversations. It's like we don't even know the no.
Yeah.
And this is really where I feel like the change is happening, and that's really exciting.
I think that's a great place to transition towards the book signing part of this evening. So, for our folks who are watching online, you can buy Floored by clicking the teal button at the bottom center of the screen, and we will send you a signed copy while supplies last. And for all of our folks who are here, you get first dibs on signed copies. So, books are available up front. And Dr. Sarah will stay seated right there. There are signing pins in that box right there. So folks will just, oh, even better. So folks will just come to you. You don't have to go anywhere. And again, books, you can just go up front to purchase your books if you already have them. You can line up. But let's have one more round of applause for both of these. Thank you all for coming, and thanks to everybody for watching online. We appreciate it.